Hi everybody, this is Jim Exby with Compliance Professionals, and today I'm going to talk to you about bloodborne pathogens. Just what are bloodborne pathogens? A lot of people ask that question. Bloodborne pathogens are microorganisms that are present in our human blood, and they can cause disease in humans. They cause hepatitis B can be in our blood. Hepatitis C can be in our blood, as well as a human I always have a hard time saying this, sorry, immunodeficiency virus, commonly known as HIV. So how can you become infected at work? That's probably one of the biggest questions that people have. In the workplace, bloodborne pathogens could infect you through situations like this. You can help an injured person without using a protective barrier between you and the person's blood. You have broken skin and you touch an object or surface with blood on it. You can touch or rub your eyes, your nose, your mouth after getting someone else's blood on your hands. Let me just comment on the first one. You can help an injured person without using a protective barrier between you and the person's blood. Nitrile gloves, Phyllis, latex gloves, there's all different kinds of them that are available. I know of an individual who went to help a person who had a damaged hand and was bleeding quite heavily. He ran to get his medical kit, pulled it out, opened it up, looked down at it to try and find some patches to put over this blood to slow it down. And all of a sudden he looked down and he saw these gloves in there. He grabbed them right off the bat, put them on his hands. Then he got the material, swabs, put them on the individual's hand to stop the bleeding. Later on, that individual came back to him and said, "Hey, I want to mention something to you. I saw you put those gloves on while my hand was bleeding pretty badly. You did the right thing." He said, "I've got HIV, and you could have hurt yourself really badly and become exposed." So let's talk a little bit about how these diseases can enter your body. Any kind of opening or break in your skin provides a place where infected blood could enter your body. It can enter through your eye, your nose, your mouth, and they're just a few of the openings, but that's not all. If you have any kind of a cut, a scrape, a burn, a rash, any sort of dermatitis, cracked, dry skin, even a hangnail, they can be entryways for infection. So how do you protect yourself? What they say is there's universal precautions that you should use. When administering first aid and during cleanup of blood and bodily fluids, let me quote this, universal precautions applies the concept of assuming that all blood and bodily fluids are considered infected with bloodborne pathogens regardless of the individual. Now, not everybody is infected with Hep C, hepatitis B, HIV. We all know that's true, but you don't know if a person is infected or not. You need to wear personal protective equipment if you're going to help somebody. So, wearing personal protective equipment, it's done to protect yourself from exposure when administering first aid and during cleanup of blood and bodily fluids. Wear gloves, safety glasses. Make sure you have those on when you're helping somebody. Quite possibly a mask, an apron. That's provided in a first aid kit in universal precautions compliance. So, sorry for stuttering and stammering a little bit. I wanted to grab this so I can show it to you. This happens to be a biohazard spill cleanup kit. You can buy these. You'll find them normally in the safety kits that are around on the job site, first aid kits. Here it is, Biohazard Spill Cleanup Kit. I want to read to you the contents of this. Number one, it's got a pair of disposable gloves in it, a red biohazard waste bag, a pickup scoop with a scraper, one fluid control solidifier package, kind of like kitty litter in a way, an antimicrobial hand wipe, a twist tie, a cleaning disinfectant wipe, 3 disposable dry absorbent towels. Pretty cheap, they don't cost a lot of money. It would be good to make sure that every safety kit has one of these. Okay, when you get gloves, one of the things that you should do if you're carrying your own safety kit, blow this glove up and see if it has any leaks in it. Make sure there's no holes in the gloves. If you find a hole in it, throw it away, get some other ones. If you're helping more than one injured person at a time, use a new pair of gloves with each person. Never reuse disposable gloves. After inspecting the gloves and looking at them, and you have them in your kit, you decide to wear them. If somebody's been hurt, time to take them off. I'd like to give you just a quick demonstration on how to do that. Let's say I have a glove on this hand also. I would reach down, grab the glove in this area so I don't get any blood on this hand, and then pull it off so it's inside out. Just that exact way is how you do it. Okay? This prevents you from getting any blood on your hands. You should make sure you wash your hands after you take these gloves off. Hand washing is probably one of the most effective ways to prevent the transmission of diseases, even less serious diseases like colds. It's just a smart thing to do, especially if there's a lot of people around you who might have the flu or if they're coughing and they have colds. Wash any exposed skin, ideally with antibacterial soap if there is some, and you should do this as soon as possible after an exposure. While you're washing, kind of be gentle. Make sure you don't open any sores on your hand, or if there's a scab on your hand, make sure you don't pull any of that off. Wash your hands immediately after you take off the gloves. Work up a good lather with soap and wash all surfaces, including the backs of your hands, the insides of your fingers. Wash everything. Make sure you get around your fingernails also. Antiseptic towelettes and waterless antibacterial hand washing liquid can be used when soap and water just aren't available. You can use those to kill off the germs. And if one of these methods is used for the initial cleaning after potential exposure, you'll still need to thoroughly wash your hands with soap and water. If blood or bodily fluid comes in contact with your eyes, your nose, your lips, any mucous membranes, immediately flush the area with running water for about 20 minutes. So how do you clean up a spill? Well, first of all, you got to secure the area. It's good to have another individual stand there. Make sure people don't walk through an area that has blood on it. Put on your PPE, put on your gloves, if you can, masks, safety glasses, and an apron. Aprons come in here. Make sure that you put that on. Wipe up small spills with paper towels. Clean up larger spills using the fluid solidifier, commonly known as kitty litter. And then sweep it up with the broom. And there's a dustpan and a scoop in here that you can also use. You disinfect the area with a bleach solution. 9 cups of bleach, excuse me, I don't want to do that. 9 cups of water and 1 cup of bleach will clean the area. You shouldn't push the blood all around, but just gently pour it on the blood, trying not to get splashing anywhere. Once you're done, you clean up the entire area. You take all the contaminated materials, towels, PPE, and put it in a red biohazard bag. That's also going to come here in your kit. And then you thoroughly wash your hands after that with soap and water, and you contact your safety director to report the incident. If you do happen to have a rescue squad there, you can give them the red bag and they'll take it with you. If not, give it to the safety director. He can take it over to a local hospital and they can dispose of it. So what do you do if you're exposed to blood? An exposure incident is when blood or other potentially infectious material gets into your eyes, your mouth, or other mucous membranes, or if it comes in contact with non-intact skin, a scrape, cut on your own hand. If you stick yourself with a contaminated sharp object, that's an exposure incident also. Remember, hepatitis can survive on surfaces dried and at room temperature at least 1 week. Now, I had a fellow talk to me not too long ago. He had a cut on his hand right here, and he'd gone into a lunchroom to have his lunch, and he just ran his hand over the surface of the table, and there was some blood. It had been there for 4 or 5 days, laying on the table, dry. He was contaminated with hepatitis C because of that. Be very, very careful, fellas. What you do, keep your hands nice and clean and follow all the rules for contamination, okay? If you're around somebody who happens to be bleeding. Thanks very much. That's what we have for today. Talk to you next month.